Hello everyone for Channel 6 TV Community Focus. I'm Dennis George and we're at Springview Hospital where March is Colon Cancer Awareness Month. And we have with us, I'm about to read all this, Kelly Rucker, the Surgical Services Clinical Coordinator. Got all that out?
You got it.
Thanks for being here.
Thank you. Thanks
for
coming.
Let's talk about Colon Cancer Awareness Month and what you guys do here at the hospital, not just in March, but in every month.
All year long. We do colonoscopies, screening and diagnostic. Screening are usually for those folks that aren't having any problems. They've hit the magic age of 50 and their doctor suggests a screening colonoscopy. Diagnostic if the patient is having some sort of problem. In
the diagnostic, does the doctor send them on over instead of it being a routine type thing?
Yes. Usually the patient will go see their family doctor, discuss whatever symptoms they may be having, and they'll refer them to a surgeon, and then we'll get them scheduled.
All right, let's talk about the Awareness Month, because it's something that is not just in March, it's something you pay attention the entire year. Do you all do anything special during March or as part of the National Day, or National Month? Do you all do anything in particular?
We do have awareness things that we do in the month of March, but this is a year-long thing for us. Screening colonoscopies can save lives.
Okay.
So it's not just the month of March; it's all year long.
Now, you're a bright young lady. Do you know number of men, typically in men, or you see more men than women with this? Because when we think of colon...
Not necessarily.
Okay,
no.
so women go through it just as often as men?
Yes, and we can, the good thing about a colonoscopy is if you find some polyps, whether they're cancerous or precancerous, if you get them in the early stages, that's what we want to do. That's how you prevent cancer. So that's why it's so important to get these colonoscopies done and prevent something from staying in the colon and growing into something that is going to cause long-term effects.
You mentioned it a little bit earlier, Kelly, that when I guess men and or women hit the ripe age of 50, and some of us are past that stage, but talk about, that's kind of why 50 is the age where they say you need to start having it checked. Can you talk about that for a minute?
50 is just an age that increases your risk for colon cancer. Studies have shown that that's around the time that polyps and things like that can appear. However, we just say it's not just for when you're 50. If you're having symptoms, you need to get it checked.
All right, talk about the procedure itself. It's not like it's one of those real bad ones, or it's not like major surgery. It's very serious, but talk about the procedure.
It is a surgical procedure, but it's very patient friendly. The worst part is getting through the prep. The prep has gone through some changes over the last couple of years. It's a little easier on patients. When you come in for your colonoscopy, we put an IV in you. You'll come in here, you'll get sedated by anesthesia, go off to sleep, no big deal, wake up, it's all over.
So like
painless.
When I had mine done and somebody came to pick me up and I said, what are you doing here? I said, I came to take you home. When they haven't done it yet, and they said, no, it's time to take you home.
Yes.
You said the prep work has changed, and I think when people consider a colonoscopy, they're more concerned about prep work and the day before than they are itself. How's that changed?
Well, sometimes we do a 2-day prep now where you're on some dietary restrictions for 2 days before, which makes the cleaning out part a little bit easier on the patient. And you don't have to drink that gallon jug of wonderful liquid anymore. You just mix a few bottles of Gatorade.
So it makes it a lot simpler, and I guess
a little more tolerable.
Can you live a more normal life for those 2 days rather than the 1 day where you're pretty much house-ridden or whatever?
You'll be house-ridden for the day before, about half the day.
Okay.
But it is a little easier on the patients. We have patients that come in that have had colonoscopies years ago compared to now, and they say it is much easier.
Okay. Okay. And again, March is Colon Cancer Awareness Month, and here at Springview, they want you, if you're time to be come in for that procedure, come on in. What's the procedure on doing that? Do they just call you guys? Does their doctor have to
Their
send them, or
family doctor can refer them to the surgeon of their choice, and then the surgeon gives us a call, gets it on the book, and we can have it scheduled within a week or two usually.
Okay. Again, March is Colon Cancer Awareness Month. If you need to be checked out this month or any month, make sure you do it. For Channel 6 TV Community Focus, I'm Dennis George.